Hey guys, this is Dr. Hub. Today we'll be comparing the various muscles. So what are they? We are going to see the skeletal as well as the smooth and the cardiac. So to get started, first we are focusing on the skeletal. So in terms of skeletal, where are the location? So it is located in the limbs as well as the body wall. So it is located in the limbs, the body wall, then also the tongue. Then it is also present in the pharynx. The pharynx as well as the beginning of the esophagus. So it is present in the limbs, body wall, the tongue as well as the pharynx and the beginning of the esophagus. Next, let's look at the cell shape. So in terms of the cell shape, it is going to be long and cylindrical. So the cell shape is long and cylindrical. And how is the branching? The branching of the skeletal muscle, it is going to be the fibers remain unbranched. So the fibers are unbranched. Next, we'll focus on the nucleus. So how is the nucleus of the skeletal muscle? The nucleus is going to be multinucleated. It is multinucleated as well as presence of it is peripheral. How is the membrane? The membrane is bounded by the sarcolemma. It is bounded by sarcolemma. Next is the presence of striations. So how are the striations? The striations, it contains of light as well as the dark bands. So all this is with respect to the skeletal muscles. Then looking at the cell to cell junction, there is no cell to cell junction. And when you look at the T-tubules, In T-tubules, there is presence of the AI junction and the triad. So how is the nerve supply with respect to the skeletal muscles? The nerve supply, it is the somatic nervous system. So let's write it down. It's a somatic nervous system. And how is the blood supply? The blood supply is abundant. It is abundant. And looking at the source of the systolic CA. So how is the source of the systolic CA? It is going to be the sarcoplasmic reticulum, or you can write it as SR. So what are some special features? The special features is that there is a well-developed sarcoplasmic reticulum. So it is well developed, as well as there is presence of the T-tubules. So how is the regeneration? The regeneration, if you see, it is going to be limited. It is limited, that is the satellite cells. And how is the calcium regulation? So calcium regulation is going to be troponin. The calcium regulation is going to be the troponin. Next, how is the contraction? The contraction, if you see, it is going to be very rapid. The contraction is going to be very rapid. And looking at the contractions, it is rapid. And let's look at fatigue. The fatigue is they get fatigued soon. You get fatigued soon. And how is the control? The control is going to be voluntary. The control is voluntary. Next, we move on to the smooth muscles. So in terms of smooth muscles, we look at the location. The location, it is present in the esophagus, and in the esophagus it is present in the distal part. Then it is also present in the urogenital tract. Next, it is also in the urinary bladder. It is in urinary bladder, that is UB. Then also the blood vessels, the urinary bladder. Next, the blood vessels, as well as the presence of the iris of eye. The iris of the eye, as well as the erector pili muscles. The pili muscle. Next, the question arises about the cell shape. So how is the cell shape? So looking at the cell shape, it is going to be short, elongated. It is short, it is elongated, as well as it is fusiform. So it is short, it is elongated, fusiform, or it is spindle shaped. So it is short, elongated, fusiform and spindle shaped. Then how is the question arises on the branching. The smooth muscles, the fibers are unbranched. So if you look at the fibers, it is unbranched. Then we look at the nucleus. The nucleus remains uninucleated. It is uninucleated and it is central. It is uninucleated as well as central. Next, it is membrane. The membrane of the smooth muscles, it is bounded by the plasma lemma. So it is bounded by the plasma lemma. Then what about the striations? The striations in case of skeletal muscle was light and dark, whereas here it is going to be absent. Then we move on to the cell-cell junction. So how is the cell-cell junction? So in the cell-cell junction, there is a gap junction. There's presence of the gas junction. This is nothing but the nexus. Then the question arises on the T-tubules. So how is the T-tubules? The T-tubules is there is none. Then what about the nerve supply? The nerve supply is going to be the ANS, that is the autonomic nervous system. This is for the smooth muscles. Next, we look at the blood supply. Blood supply is going to be scanty. And what about the source? The source of the cytoplasmic calcium. Cytoplasmic calcium is going to be the SR. SR is for the sarcoplasmic reticulum as well as the presence of the ECF. Next, how is the special features? The special features, it includes there are dense bodies. There's presence of the dense bodies. Then there is also the caveolae as well as the cytoplasmic vacuoles. There's presence of the cytoplasmic vacuoles. Then the question arises on the regeneration. So how is the regeneration in case of the smooth muscles? The regeneration, the answer is yes, it is present. So regeneration is present. Then the question arises on the calcium regulation. The calcium regulation is by the calmodulin. This is the smooth muscle. It is by the calmodulin. That is a myosin. Then how is the contraction? The contraction will be slow in terms of the smooth muscles. Then fatigue, it does not get fatigued. The smooth muscle does not get fatigued. Whereas the skeletal muscle, it gets fatigued rapidly. How is the control? The control is totally involuntary. So the smooth muscles has a involuntary control. Now we'll focus on the cardiac muscles. So cardiac is very important. The cardiac muscle, where is it present? It is present in the walls of the heart. So it is present in the walls of heart. And how is the shape? The shape is going to be, it is short, narrow and cylindrical. It is short, it is narrow as well as it is cylindrical. So how is the branching? The branching is going to be, the fibers are branched. Next is, we are going to look at the nucleus, membrane and the striations. So in terms of the nucleus, it is uninucleated and it is present central. So how is the membrane? The membrane, it is bounded by the plasma lemma. It is bounded by the plasma lemma. And how is the striations? The striations is going to be, it has faint light and dark bands. It has a faint light as well as the dark bands. Next, we will be looking at the cell-cell junction, the T-tubules, the nerve supply and the blood supply. So in terms of the cell-cell membrane, they have presence of the intercalated disc. This is very, very important. There's presence of the intercalated disc. Next, in terms of the T-tubule, there is a Z line or the dyad. And the nerve supply is by the ANS, that is autonomic nervous system. Whereas firstly, when we saw the skeletal, it is going to be the somatic nervous system. So how is the blood supply? The blood supply, as it is concerned with the heart, it is going to be abundant. Next, let's look at the source of the systolic calcium, then some important features as well as how a note on the regeneration. So how is the source of the cytosolic calcium? The source of the cytosolic calcium, it contains the SR as well as the ECF. So the special features, what are they? The special features, there is presence of the intercalated, disc. And how about the regeneration? The regeneration is that it is none. Then let's highlight on the calcium regulations. The calcium regulations as well as the contraction, the fatigue as well as a control. So in terms of the calcium regulation, the calcium regulation is going to be by troponin, and the contraction is going to be very rapid since it is concerned with the heart. And what about the fatigability? The criteria here, it is that it never gets fatigued. Then comes a question on how is it the control. The control is going to be involuntary.